Well, thank you very much for the opportunity to talk today for the REACH. It's my pleasure to be here. I have been working with children with Hirschsprung disease for a long time now. And as my talk today, I have no disclosures. And kind of in my brief time, I'd like to just kind of, we won't spend much time on review. We've done that with Dr. Langer, Dr. Shakshir, Dr. Yeager, discuss how to kind of keep track of your child's bowel history and different tips, tricks that may be beneficial in caring for children with Hirschsprung's disease. So we've all seen this slide earlier in the day. Mostly the Hirschsprung disease is in the rectosigmoid, but we have talked about also total agangonic colon and extension of small intestines at times. These may be key as depending on how to achieve social continence as the child gets older. Also, in Hirschsprung's disease, most children do well. Some long-term studies have shown children have problems with fecal soiling, smears, constipation, enterocolitis before and after surgical repair, bowel obstructive symptoms, strictures, and then of course, always kind of keep in mind psychological issues as these children have had many rectal exams from a young age all the way up until older, and just keeping that in the back of our minds as the children continue to age into teens and adolescence and adulthood. I won't spend too much time on this slide. It's been discussed. In taking a history to your pediatric colorectal team, some tips to kind of help remember what to log, what to bring may be helpful to discuss when you're all together in your clinic appointment. What are your child's stool patterns? Do they go daily? Do they go every day? Is it a couple times a day? Kind of keeping a log of that. What are the timing of bowel movements? Is there any dietary changes or fluid intake that alters your child's bowel movements? Bristol stool scale, I'll show that here shortly. Keeping a log of what the stools look like. And then of course, diet, water, how active are your children? Are children active in lots of sports, PE, different schools have different programs? And then are there any other symptoms? So in caring for children, stool documentation, there's many different paper, there's notebooks, there's apps as the REACH organization is working towards to help log stools for providers and to use that information. A lot of times parents may have an app that they download and send that to their provider team to kind of review on a weekly or bi-weekly basis. And then also you can incorporate your teachers into your during your children's schooling. Can they take a log? Do the children need support with IEP letters or a 504 plan? Provider teams can write letters of support that they need more time to toilet during their school day, extra assist with any hygiene, need to keep their water bottle with them at all times. I know post-COVID, there's a lot more cleanliness, hygiene, different things are at different schools. Different types of stool records, just date, time, and I try to encourage families to, as children get older, and even children that have any developmental or other health concerns, they can put the smiley face on. It was a good day, or was it a medium day, just an okay face, or was it a frowny face? It was a bad day. I had a couple smears. But this kind of helps work with them taking account, kind of being participative, and they can kind of help log their own stooling pattern. And again, you can download this or send it to the provider team on the MyCharts or different institution systems that they have for messaging for secure chats. But this is the Bristol stool chart. I refer to this as, helpful in helping parents kind of assess, so they can tell the provider, myself, what are their stools today? Are they a type 1, type 2? And those are really kind of too thick. And are they having other stool holding behaviors that would, we want them to be more loose, not too thick, so they can pass them easily. It helps kind of give the provider team a little more guide of what the stools are like. All goals are for children with Hirschsprung to achieve normal bowel habits. And then things to always watch for are, as we have talked before in previous talks, constipation, incontinence. And then some children may have more difficulty achieving the normal bowel habits, depending on their, if they have other developmental issues. So things to always kind of think about are what are the child's diet? Do they take too much sugar, too much gluten? Different dairy products can change their bowel habits. And then, what are their school menus like at school? Do the child bring their lunch to school all the time? And do they eat the same thing every day? Do their child's lunch times vary at different times of the day? I know some schools have A days, some schools have B days. And then, are they getting enough water intake? And is that water intake flavored waters, caffeinated products as they're getting into the teen years? A lot of those caffeinated high strength beverages have a lot of caffeine in it and can cause other health issues in children. And then what's their activity level? There's different ways to monitor their steps, as far as step counters, watches, apps, and then of course the old fashioned that I love, the sticker chart of how they're doing with their day. Dr. Yeager talked about this in her previous talk, avoidance of certain foods that may cause more blockages, excess odor, a lot of the cauliflower, broccoli, those eggs, beans cause a lot more gas. One thing I always advise families to try at least one new food at a time, not to do too many new things at one time, so we can see if what's working, what's not with their stooling. And then trying to keep the children on a regular meal schedule. So then we can hopefully keep them clean while they're for their day at school, for their day activities, depending on what they have going on with their schedule. We don't want them to have a inopportune stool at a wrong place, wrong time. Always sitting for meals, make sure we chew our food well, and avoiding any excess gas straws, and chewing gum can cause a lot more bloating. And then also always discuss with your dietitian or your provider team before adding any fiber into your diet and or additional soluble fiber. Yes, sometimes we can get too bloated at times. Laxatives, Miralax, lactulose are the common ones. Hold the water in the stool to make it more soft. But again, if some children are having more problems with loose stools, incontinence, as Dr. Langer previously spoke, the laxatives are stopped and then the children do much better. But the stimulants are needed in times to give as we previously heard, that the colon motility just doesn't work the same in children with Hirschsprung's disease. They just kind of need the extra squeeze. Some gentle options are Senna, Bisacodyl. Bisacodyl is more gentle, but there's not really a good liquid form for younger children to take. Importance of time toileting, which I know will be in a talk after mine, but importance of taking that time after they've had their stimulant, about an hour after, take the time where they can do their special book, their special app, their special activity, movie, show, that they can have their stool ready to go there. And then they can even have a little table rolled in. I have some children that go in and do their homework during that time to get all the stool out after they've taken their medicine or after they've had their irrigation. Sticker charts are a good to document in success. And once they get to a certain number of stickers, then they get to pick out their prize, whatever the family decides. This is a good picture as far as positioning. We want the knees elevated higher than the hips, about 35 degrees. And a stool doesn't have to be a fancy, expensive stool, just something to kind of get their knees higher than their hips. We just try to avoid that 90-degree angle. One stool that works is called the squatty potty. But also in thinking for protecting children's skin, if they are having a period of time where they're having a lot more looser stools, trying to avoid just too much friction, too much rubbing of the skin. We want to be gentle to the perianal skin. Good old fashioned peri bottle works great. Have one at school, have one at home. I always try to get a home bag prepared, ready for the families so that they can have this kind of like their emergency to go bag should there be an accident or a soiling incident. Gentle soft cloths work best. Newer water wipes are on the market. Some of the wipes have too much scents, too much alcohols are in those normally, and they can cause further skin breakdown, denuded skin. So recommend against any scented products at all possible for any topical agents for protecting the skin. Cavalon is a good product for skin protectant, no sting, and then of course stoma powder to kind of help dry up moisture. But we really want to get that good protective layer to protect the good intact skin if we are having more incidents with soiling. And as children age, they have different stressors and different parts of as they grow older. And then we see changes in their bowel management. They have more difficulties with soiling and incontinence, and may need to reassess over time. Puberty is a big stressor, so things just kind of get out of whack, and we have to kind of regroup and see what is working, is not working, looking at the stool log to see what will work best for the child. Again, this has been talked for always starting from the day of diagnosis of education is when to call for enterocolitis signs, but also just when to call your provider team if you're seeing more streaking of stools or incontinence of stools at school, at home during their activities. And then is it more in the morning times because that's after they've had a period of sleep and they are more relaxed. That will be helpful information to discuss with your provider team. Of course, if there's any abdominal distension, recommend to call. And then of course, those highlighted in red are the signs of concerns for enterocolitis, which as you previously heard with Dr. Langer, can happen before, after surgery and need to be treated. Our goals are for children to have more and more independence, be able to care for themselves, especially as they transition into the adult world. And then also just always thinking about the psychosocial impact and supporting that child as they transition from in the puberty ages, or they transition into maybe a different school or into the adulthood. Seek out what are available in your area if there's any local support groups. Here at WashU, we have a pediatric family support group that meets virtually every other month, and there's different presentations and different helpful information for families. But seek out if there's any other support groups in the area that would be helpful for discussing or even just knowing new information with other families. So bowel management to help keep that colon clean so that there's less soiling accidents, less incontinence during the day. Your provider team may recommend enemas, rectal irrigations, and then Peristeen Plus is a transanal irrigations is for children that have more independence or can do have had more maturity or able to help and assist. But then this is more of a goal working towards them being independent with their irrigations, keeping the remainder of their colon clear. A lot of times it works in conjunction with pelvic floor physical therapy, biofeedback, adjunct treatments with your provider team with Botox. It's kind of fitting all the pieces of the puzzle together in bringing all the information back and really discussing it with your multidisciplinary provider team. Is there any diet recommendations that we need to avoid or work towards, or better fluid intake? Is there a bowel management system that would work better for as far as enemas? And in training for enemas, it's best to have a clear colon. Sometimes many bowel clean out are needed before they come in for their training, so that the child will experience the best outcome with doing the transanal irrigation or rectal irrigation. Overall, goals are from making the child have the best quality of life so that they can go on to experience all their best activities and just live their best life ever. And I just love these pictures because it shows a favorite young man that is doing all his wonderful things.